Okay, hello. We're going to go over the SFMA top tier. So, Bashi, feet together for me. Thank you very much. We'll have your mouth closed, okay, but let's not clench. And I just want you to bend forward and try and touch your chin to your chest. Okay? Very good. Any pain with that?
Mm-mm.
No pain. So what I'm looking for is a nice kind of uniform curve. In her situation, and again, like fluid movement, showing that she can control it in her situation. I'm seeing a little bit of an angulation at like the C7 T1 junction. You can relax. Um, Also, another compensation would be for her to have like excessive thoracic motion, thoracic flexion to help get her there. Next thing I want you to do, Bashi, is can you look all the way up to the sky, tilt your head all the way back. Okay, and now from here, I'm looking for the top from the top of her head to the bridge of her nose to see if she's getting about 80 degrees. If she's getting closer to 90, you can relax. Any pain with that?
Mm-mm.
What I did notice was a little bit of an angulation, so that's in her cervical spine. That's another compensation with also the excessive thoracic and lumbar motion. Bashi, what I want you to do now. Okay, so I'm gonna find your mid clap right about there. Okay, can I have you look over your right shoulder for me? Okay, good. Any pain with that?
Nope.
No pain. Okay, good. And she is just shy of her mid clavicle. You can relax. Also, so that would make it dysfunctional. I saw a little bit of a shoulder hike, but what you can also see is thoracic rotation or even like side bending to help her get there. Next, what we're gonna do is upper extremity one. So, body, can I have you face the wall?
Mm-hmm.
Good. Let's bring your hair. I want you to take. Let's do your right arm, and I want you to reach underneath and touch the bottom of your shoulder blade, your opposite shoulder blade. Good. Any pain with that?
No.
Okay, so what you can see, you can even see it through the shirt, is her two compensations. We're seeing a little bit of radial deviation. We're seeing a little bit of winging of that scapula. Again, always want to see a nice fluid, smooth motion throughout all these. In Bashi's situation, she wasn't really doing that. It was kind of a little bit too motioned as well. Next, what I want you to do, Bashi, is take that same arm, reach it behind your neck, and touch the top of your other shoulder blade. Good. Any pain?
Nope.
No? Okay. Good. Can I have, so we're going to do that one more time, just facing that way, same thing. And so for here, go ahead, you can relax. I actually did see a functional movement. It was smooth, it was fluid, but some common compensations that you can see, again, are that winging. You can see kind of shoulder elevation, or another common one is kind of forward head, just like protraction to help get that arm to clear your head. In Bashi's situation, we didn't see that. Okay, so what we're going to be doing now is multi-segmental flexion. Bashi, what can I have you do is, let's keep your knees straight, all right? To the best of your abilities, let me see if you can touch your toes. Okay, good. Any pain with that?
Nope.
Okay, so what we're looking for is about a 70-degree angle. Go ahead, you can relax. All right, and I would say that she's achieving that, and as well as a nice uniform curvature of her spine, a nice posterior weight shift, and is she actually able to touch her toes, which I would say she is. I would call that functional. Common compensations would be, excessively bending your knees, as well as, just bending a lot through your thoracic spine. That would be a couple of compensations for that. Next, what we're going to do is the functional. Next thing, do we have the ceiling space? Either way. Okay. Can I have you lift your arms all the way up overhead? Nice. Okay. Good. So we're looking for 170 degrees, which she's getting. Next, can I just have you lean all the way back? Good. And I'm just going to lift this up and peek. Okay. Any pain with this?
No.
Okay, so I saw a uniform curvature. I need you to do that one more time just for the camera. All the way back. Good. I'm looking for her ASIS to clear her toes. And I'm looking for the spine. Go ahead, you can stop. the spine of her scapula to clear her heels. So the spine of the scapula was clearing, but I did not feel as though her ASISs were clearing her toes. So I'm going to call that dysfunctional, non-painful in her scenario. Common compensations, I think, for this one is where you get about 5 degrees of knee bending. That's a real common one. And again, any angulations, we want to see a nice kind of uniform curvature. Next one I'm going to have you do, Bashi, is, so I'm going to be right back here. Can I have you put your arms at your sides? Good, just like that, palms up. And then what I want you to do is just rotate your whole body over your right side for me. Good. Is there any pain with that?
No.
Okay. And then I'm just going to come back here and look. No pain, right? Okay, so in her situation, I would call this functional, non-painful. I was at pretty much like the 45-degree mark from her pelvis, so she cleared me, she passed me, and then I went behind her to see if her left shoulder here would pass, and I would be able to see it from behind. And I did. I didn't really see much compensations. Her shoulders stayed level. She wasn't protracted in the shoulder to show me it. And her feet pretty much kept the same positioning, maybe a little supination on the right. But other than that, she seems to be pretty good. Now, so we're going to do a little squat, okay? Can I have you put your arms out in front, keep those feet together? Good. And I just want you to squat all the way down as far as you can go. And I'm guarding. Good. And clearly, you can see that she's breaking parallel with her femurs. Any pain with this?
Mm-mm.
Okay. Now can I have you take your arms and make knuckles and put it on your sides? Good. And she's able to place them down pretty easily. No pain, right? Good. You can come back up. So for this one, I saw that she was balanced. Bashi was balanced on both sides and even. So that would be a common compensation. Is like having her weight more on one side than the others, or if her heels came up to kind of compensate for her anterior tib and stuff like that. And again, her femurs broke more than parallel. We're looking for pretty much 90 degrees. Okay, so next what we're going to do is the single leg balance. So, Bashi, can I have you face the camera? Very good. All right, so what I want you to do is you can put your arms at your sides, all right? I just want you to pick up one foot. You can pick up your left foot just enough to kind of clear the floor. Good, and we're just going to hold that there, okay? So go ahead. And for this test, she's trying to hold it for 10 seconds, trying to keep her posture stable, keep her head, her shoulders, and her pelvis level, and not sway too much. You can relax. Any pain with that? No? Okay, I'm going to give her a little break. Bashi. Now we're going to do the same thing with your eyes closed. So you can find your balance with one foot and then close your eyes, and I'll hit the timer, okay? And for this test, very good. You can relax. Any pain with that?
Nope.
So for this test, what we're looking for, kind of that same thing. We're looking for that foot to stay stable. We're not looking for much movement. Everything to stay as level as possible. But because you're eliminating the visual system, it's okay to get about a 50% lateral sway. Other compensations you can see, obviously, for both of them would be kind of like helicopter arms or their feet sliding out left to right. But Bashi didn't do that, so I would call that functional, non-painful. Okay, so now we're going to go into our single leg stance breakout. So this would be something that we would do, obviously, if she was dysfunctional. And what we're really looking for is to see the source of her balance deficit. So is it a vestibular? Is it a proprioceptive? Is it even a visual? Or is it a combination of the three? So the first way we're going to test this is we're going to have her stand on this kind of faux Airex pad. So Bashi, can I have you stand on that? Both feet, good. They're close together, but about shoulder width apart. Very good. And we're just going to stand there for 20 seconds with your eyes open. Okay, ready, go. So in this test, we're obviously looking if it for it to increase her pain, the same pain that she felt coming in. We're looking again for that sway or anything like that, to for her to lose her balance or anything like that. And we would note that as a dysfunctional pattern. You can relax. So in her position, we're looking more so for stability to give her that functional. So is she stable? Is she maintaining her pelvis and shoulders? Are they level? Those kind of things. We want to see them that they're still connected. Was there any pain with doing that? Mm-hmm. All right, now we're gonna do the same thing. Bashi, can you step on? Good. You're just gonna find your balance, and we're gonna close your eyes, and we're gonna do the same thing. Okay. Go. So this, and good. You can come up. Any pain? Mm-hmm. So at this point, I would call Bashi functional. She didn't sway or anything like that. No, like excessive dizziness. Again, everything was staying level. That test is more so disadvantaged. So you're eliminating vision. You're disadvantaging your vestibular system. I'm sorry, your proprioceptive system, because you're on that soft surface. It leaves your vestibular system. So we're starting to rule that out. Now, if that was, whether or not that's functional, or if that is functional, we would go to, if that was dysfunctional, I'm sorry, whether it's painful, non-painful, we would kind of go right into half kneeling. But because this is functional, let's see if we could tease out the dynamic aspect of that as well. So Bashi, we're going to stand on there, okay? And then what I'm going to have you do is tilt your head left and right. So yeah, you could drop your ears to the sound of this metronome, okay? We're going to do it 5 times each side, okay? Good. And now I just want you to look straight and stand there. We're going to stand there for 10 seconds, okay? So now, because of the nature of this system, we're trying to target different canals of the ear. You can step off. Any pain with that? No? Okay. Actually, you don't have to step off and on. You can come back on. Now let's do forward and back. Okay? Ready, set, go. Good. And stand. So all these tests, they're disadvantaging the vestibular and proprioception. So the visual does play a component, and relaxing dizziness with that, okay? But this is really testing your ability to kind of react to that vestibular, to the dynamic motion that affects your vestibular system. Now, can I have you look over your right and left shoulder? Mm-hmm. Okay. Same thing, 5 times a side. Good, and stop. Good. Any pain with that? Mm-mm. Okay, is it okay if we do that with your eyes closed? Sure. So we're just going to turn and then look straight with your eyes closed, okay? So let's do the head tilts and go.
Oh, sorry.
That's all right. Good. Just
keep them closed?
Yeah.
Sorry.
That's all right. Can we do that one more time?
Yes, we
okay.
can. I apologize.
Ready? One more time?
Sure.
Okay, and then just look. Okay. Any pain, any dizziness with this? Okay, so we're clear to move on to the next. So can we just have you do that up and down now?
Mhm.
Okay, ready and go. Good. And again, we're looking for any like excess sway. We're not really seeing that. Any pain with this? Okay, the dizziness is still all right.
Mhm.
Okay. Last but not least, we'll do our we'll tilt our head left and right. Ready, set, go. Good. So this is eliminating the vision, so it's more so testing your vestibular and somatosensory. But even all that stuff is all kind of disadvantaged or eliminated. You can stop. Any pain with this?
Mm.
So this is kind of just teasing out to see how the systems are working together. Once we kind of figured out, okay, Bashi in this instance is functional, let's see if any of her postural components may be the issue. So Bashi, can I have you in a kneeling position? We're just going to do one side. Can we have your right knee down?
Sure.
We're going to put that right knee down. We're going to have your left foot kind of like in front, in line. Good. Let's have your back foot all the way down. Very good. And so what this is testing, this more so is testing your her proprioception, and this is really isolating out her trunk and her hip. Okay, so Bashi, can I just have you hold that there?
Mm-hmm.
And again, we're looking for she's trying to stay tall, stay solid for about 10 seconds to be functional. Okay, any pain with that? So what this is really doing is eliminating her foot and ankle, and really isolating her hip and torso. Now to kind of eliminate the torso, Bashi, can I have you into a kneeling position? Good. You can actually move forward a little bit. Let's see. It's gonna. Can you turn sideways?
Sure.
Yeah, like that. Perfect. Okay. Perfect. So now, let me have you hands and knees. All right. Very good. And then what I want you to do is, this is pretty much a bird dog. So
Okay.
can I have you lift one arm and the opposite? Oh, let me just move your book back. Can I have you lift one arm and your opposite leg up for me? Good. And just hold that. Very good. Relax. Any pain with that?
No.
Okay, so what we're looking for is a nice quality motion. In her, can I have you do that one more time? Sure. Okay, relax. Any pain with that?
No.
Okay, so I would actually classify Bashi a little bit as dysfunctional in this motion. She did kind of her weight shift. She had a significant weight shift. She also kind of like lost her balance there. I'm seeing a little bit of maybe like a lumbar lordosis in this instance. So now we know, okay, we've kind of isolated out the hip at this point. Once we know that like hip stability may be an issue, I think it's time to move on to the ankles and see their role in Bashi's balance. Okay, so we're going to do an upper extremity breakout for upper extremity 1, all right? So the first thing that we have to do is we have to remove the postural stability component. So we're going to take her from an upright position where the posture and the weight bearing position may play a role. We're taking her completely out of that by getting her on the table. So the first thing we're going to do, Bashi, can I have you on your hands and knees, please? And in a child's pose, just sit all the way back. All right, good. And now we're going to look at her thoracic spine, and we're going to see if we can rule that out as an issue. So can I have you put your left arm behind your back? Yep, just like that. I'm going to come on this side. And then can I just have you, try not to lean into me, but can you just rotate all the way up? Good, and we're looking for 50 degrees. She's able to get it. If not, I would check passively. Is there any pain with that?
No.
No pain. Okay, you can relax. So what this tells me, right, since she's able to get 50 degrees of that rotation, that she's functional, normal. If she wasn't, let's say she wasn't able to get it and she was dysfunctional, then I can check her passively, which I just did. If she was able to get that 50 degrees down, we know it's a motor control issue. If she wasn't able to get to 50, then we know that it's a mobility issue of her thoracic spine. So next what we can do is, Bashi, can I just have you lay on your stomach right over here? So we've ruled out the thoracic spine. Let's check the shoulder joint itself. So can I just have you do that same motion? Bring it all the way back. Good. Any pain with that?
No.
And for Bashi, she is a little dysfunctional. There's a little bit of winging, all right? So let's do that again, one more time. I'm going to check. She's able to get there, and she's not able to get any extra motion. So what I noticed, and this is true for all of these motions, is in this scenario, in all scenarios, you're looking for a smooth fluid motion. In Bashi's case, it was kind of smooth, but with a little bit of winging. So let's look into that shoulder girdle a little. I looked into the shoulder girdle a little more. She was able to get it passively. She was able to get it actively. So that means that same thing. If active she wasn't able to get it, then we would check passive. If passive was a lot more and she was able to get it, we know it's a motor control issue. If she was more functional with the passive, we know that it's a motor control issue. If she's dysfunctional, active and passive, she's not able to get there, we know that it's probably a mobility issue of the shoulder girdle itself, just kind of all three of those motions combined. Next, what can I have you do is just in this 90-90 position here. Good. And I may bolster this up. Good, like that. Yep. Can I just have you bring your palm all the way up? Very nice. And here, I was checking her shoulder blade to make sure that's not moving. We want pure GH motion. I'm checking to see if she gets 60 degrees of internal rotation. She's getting a lot more. Any pain?
Mm-mm.
And that was a fluid motion. So if she wasn't, I could check passively to get more. That way we know if it's a mobility or a motor control deficit of the internal rotators. Can I have you now bring the back of your hand all the way up?
Mm-hmm.
Good. And in this position, she's getting about 65 degrees, I would say. So I'm going to check passively. She's able to get much more passively. Is there any pain
No.
with either of those? No? Okay, good. So overall, if you factor in, her essentially 90 degrees of internal rotation with her 60 to 65 degrees of external rotation, you're looking at a functional arc, even though you would kind of like those numbers reversed. Let's now check her shoulder extensors. So let's have you put your hand here, keep that elbow straight. Let's bring it all the way up. Bring your arm all the way up. Good. Any pain?
No.
That seems smooth to me. She seems very close. She's getting 50 degrees, but I can check more. Okay, so relax. Okay, right about there. And she does get a significant amount more. Any pain with any of those?
No.
Okay, good. So we know from Bashi's test, even though she is able to get functional actively, passively I was able to get her a little bit more, so we can look into the shoulder extensor motor control and see if that's like a main contributor for treatment. And last but not least, Bashi, can I have you just take your thumb and let's see, just bend your elbow. Let's see if you could touch your collarbone. And she can. Any pain with that?
No.
So if she wasn't able to do that, I could take her passively. So, yeah, Bashi, you can relax.
Mm-hmm.
With this, we're pretty much testing the elbow joint. And with her findings, I can say that her elbow joint wasn't the issue. She was able to do it actively. And obviously, she was able to do it passively. She was able to touch. So we can kind of say that the shoulder extensors are an issue here. But because she was functional, I would say this is more just like a mixed upper extremity 1 pattern. And we would just kind of be focusing on all those components together as a functional unit.